Thank you very much, sir. It's really an honor to be with JB sir. Like, sir is my mentor and he had taught me how to write a paper and the importance of writing a paper. And it's really a big privilege for me. I'll be speaking about something, a very interesting tumor. And when we talk about this tumor, my question to it that is it actually a tumor or a misnomer? Because I feel that it is more of a misnomer because we do not see any endothelial proliferation. And hence, I feel it is more of a hematoma. And as per the ISFA classification, it still stands that it shows no endothelial proliferation, so it should be more of a hematoma. So this primary intraosseous vascular malformation is rare, and it usually involves a long bone. And the first case was reported in 1942, but orbital cases are much less, having a female preponderance. So what is the inciting factor? The factor is basically a trauma or ischemia. This incites angiogenic proliferation, and this along with the, is it coming? Angiogenic differentiation, and this along with a bony resorption and bony differentiation, it leads to the formation of a tumor within the bone, which we call a intraosseous vascular malformation. So if you look to this intraosseous vascular malformation, it can be in a single site or it can be a multi-site. But for us being an oculoplastic surgeon, we need to differentiate before the surgery because these are real vascular tumors. And one of the common differential diagnoses is fibrous dysplasia. But if you look to the tumor, if you look to the CT scan, you will see the fibrous dysplasia has more of a ground glass appearance as compared to the intraosseous malformation. Sometimes it gets difficult to be differentiated from meningioma, but if you look to the striations within the tumor, it looks more radiating as compared to the vertical striation that we see in the meningioma. So the definite diagnosis is by histopathology. I'll not go much into details. I have come here to learn from you all, but for me, being a surgeon, the treatment of choice is surgery. These tumors are real vascular tumor. You need to do an embolization. Like this is a lady which we have operated, and if you can look the tumor out here, and this is through a transconjunctival approach, and this is a tumor during the operation. So that the surgery involves that the end block of removal of the tumor. This is very important, and we have till date we have got 6 or 7 cases. And once we have removed the tumor totally, we have found that till today, even with a follow-up of more than 5 years, there is no recurrence. And since you are removing the tumor, it is very important that you have to do customized reconstruction of the orbital defect, the bony defect that you have created. This is the lady before and after surgery. This is another interesting case, but we knew that this is a vascular tumor, and when we had done a DSA, the feeder comes from the external carotid. So we had done embolization before taking her for the surgery, and then we could remove the whole of the tumor. And secondly, I would also like to share another case like this lady. The differential diagnosis was difficult because it was looking more a ground glass appearance, and so we thought to be more of a fibrous dysplasia. But when we had done the DSA, we found now the branches comes from the internal carotid. So we cannot go for embolization because the vision will be affected, but definitely we only to prove the diagnosis, we have done the incision biopsy, and it came out to be intraosseous vascular malformation. So this is do I have time? This is another very interesting case. She came to me like with this slowly growing mass, and this gives a typical honeycombing appearance that we have seen there. And then I have done the preoperative embolization, and you can see the feeder vessel. This is a branch of the external carotid. And after doing this, to be more specific, I have used the navigation system exactly to mark the tumor, because this is a tumor you really need to excise, and we all know that the treatment is full excision of the tumor. So this is something a very challenging surgery, but I really enjoy doing the surgery because this is a tumor involving the whole of the maxilla, where I had to do a very wide exposure, and this is how the tumor looked intraoperatively. As because we have already done the embolization, so we could remove the whole of the tumor along with the maxilla, and following the tumor removal, we need to do a bony reconstruction, where I have taken a rib graft, and then with the rib graft, the whole of the reconstruction has been done. And this is how we harvest the rib graft and done the reconstruction. And this is what she looks post-operatively. This is before and after the surgery. So I conclude here mentioning that this primary intraosseous vascular malformation is still a misnomer. It is more, I feel it is not a tumor, it is more of a hematoma, because Ki67 shows it is negative, and Ki67 negative means no endothelial proliferation. So, but one thing what I have realized, that complete excision is the treatment, and very recently we have reported this tumor in the journal Orbit, the 6 cases that we have seen during our course of management. Thank you very much for your patient hearing.